Hi, this is Kavanaugh coming to you from the American College of Rheumatology Convergence 2024 in Washington, D.C. for Room Now. So lots of subjects being covered about lots of diseases, big interest in psoriatic arthritis, and a very recent interest in psoriatic arthritis has been the impact of sex on the disease characteristics and, of course, the response to therapy. There have been a couple of abstracts on that, 1709, 1471, and there was also a seminar where Leahy Ader, who's the senior author on those other abstracts, was talking about the response to therapy, and Laura Coates was talking about just differences in disease characteristics in psoriatic arthritis patients based on sex. And it's an interesting topic. Among the rheumatic diseases, psoriatic arthritis is one that's about equal in men and women, about 50-50, unlike rheumatoid arthritis, where it's 80 women for 20 men, or ankylosing spondylitis, where it's reversed. So I guess for a while we didn't really consider the impact of sex as we do for something like systemic lupus. But it does have a lot of relevance, and it's been a topic that hasn't had a lot of attention paid to it, but it's certainly changing now. If you take baseline characteristics of patients with psoriatic arthritis, for example, in clinical research studies, there are differences that you see in a lot of studies. Women tend to have more pain and assess their global activity and function worse. Men tend to have a little bit more inflammation measured by the CRP and more skin disease relatively. Over the course of treatment in general, across quite a number of therapies, it seems like the response or the effect size for women with PsA may be less than that of men. The intriguing thing is we really don't know why. Some people have suggested that maybe it's a pain, the perception of pain, and that certainly can be different between the sexes. But there are also distinct immunologic differences and the subtypes of different immune active cells like macrophages. We don't know how that relates to the clinical differences nor to the response to therapy. And of course that too is a very complex topic, as the hormonal milieu for men and women absolutely changes over time. And how does that change impact the clinical manifestation? So a lot that we don't know, but I think we all recognize now that there can be important differences. So we're at least paying more attention to clinical trials to know that the data need to be assessed according to the sex of the patient, among the other important baseline characteristics. So kind of a stay tuned. I think this is an area that's a hot topic. I think it's one hopefully we'll have really more concrete answers for in the future, which will help us take care of our patients with psoriatic arthritis. From the American College of Rheumatology Convergence, Washington, D.C., this is Kavanaugh for Room Now.